Louisiana was hit hard last flu season. Thousands of residents had the flu or flu-like symptoms. Doctors want to prevent that from happening again this year. So Dr. Brent Wallis is here today to tell us what we need to know to protect ourselves from the flu and also to remind us exactly what the flu is and how do you know if you have it? What is the flu?
So the flu is a highly contagious respiratory illness that's caused by the influenza virus. And there's multiple different strains that change from year to year. What's most important to remember, though, is that it's spread through water droplet contact. So anybody who coughs or sneezes around you can actually spread the virus to you.
Wow, and it has a spray. The spray kind of goes far. So if somebody's sneezing 2 feet away,
it definitely can.
It
can even live on doorknobs, so you have to be careful. Make sure you wash your hands.
Oh, wow. Okay. The colds and the flu have the same symptoms sometimes, don't they? So how do you know if you have a cold or if you have the flu?
So they definitely can have some of the same symptoms, usually coughing, sneezing, a little bit of a headache. What's different with the flu, though, is the flu is usually much more severe. Typically, the fevers can be as high as 100 or even above. And then you really feel muscle aches, back aches, severe headaches. You really feel knocked out with the flu.
It knocks you out like a bat. We were talking about earlier. You feel like you can't do anything.
Right, yeah, can't get out of bed.
And then if you're not sure about your symptoms, it's an easy way to figure it out, right?
Definitely. If you see your doctor, typically the physician will actually do what's called a nose snog. They'll actually do a simple test, no blood work or anything, and they can tell you if you have the flu and what type it is.
Once they figure out whether you have a flu, if it's within 24 hours of your symptoms, there is help.
There is, definitely. There's a medication that usually shortens the duration of the flu. It doesn't knock it out completely and it doesn't prevent it, but it does have to be initiated within 2 days of your symptoms.
You saw the kid in there sneezing into his sleeve. That's a good thing to do, isn't it? If you're sneezing,
definitely,
to keep people from getting sick.
Well, and especially since fall is just about here, it's important to remember to make sure you don't sneeze wide open. You know, don't spread those water droplets, and then make sure if you do sneeze that you wash your hands afterwards.
Yeah, but even if you wash your hands. If somebody's touched a doorknob, you're still in trouble. So it's really hard to hide from getting infected, isn't it?
Right. That's why it's very important to get your flu shot. And since we're, in September now, the flu shots are finally being made available. And it's a new shot every year, so you want to make sure that you get your vaccine updated every year.
Is it 1 or 2 strains this year? You know how they always have some double strain or whatever?
They do. There's 2 types of flu, and the strains actually do change from year to year. So this year, actually, we have to wait and see after a few cases what strain is around.
All right, Dr. Brent Wallis says go get your flu shot now so you don't have to worry about it later. We appreciate it.
Thank you.
Okay.